Well, you think of commuting as the worst part of the day, right? And a new report shows that New Yorkers have it the worst, spending more than 6 hours a week on commuting. Well, what can you do to cut down your travel time or at least better use the time? Organizational psychologist Woody Woodward, better known as Dr. Woody, joins us with advice. So let's start by taking a look at some of the numbers, because here's the New York weekly commute is 8 hours and 18 minutes. It's like spending an entire workday on the road.
I mean, I know people that have 3 hours a day back and forth, and they're taking the train, which you think would actually be faster here. But, you know, the reality is we do spend a significant portion of our time getting to work. And the problem is a lot of that time is stressful time, and I don't think it has to be.
All right, so let's take a list of the cities with the worst commute. So it's New York, San Francisco, Washington, Houston, and Fort Worth. And even if you go to the bottom of the list, Milwaukee, you're still commuting 3 hours and 40 minutes every day. That daily commute for the New York City people, 75.6 minutes on average. This is nutty time. You were telling me in the break before we came to air that people need to... It's about how you think about the time.
Right. So I'm going to get all psychologist sounding on you, but here's the reality is a lot of times the stress comes from those little things. Being bumped, being in traffic and someone's not moving. Well, guess what? A lot of stress is about control, or really perceived lack of control. When you feel like you can't control things around you, guess what? You have to step back and start thinking about those things that you're letting get to you. They're not necessarily coming at you. Let go of them. Learn to relax.
You want me to be mature? That's so hard.
Breathing exercise you can do in your car. You can do on the train. Podcasts have become really popular. Make it you time, but let go of the little stuff.
So how do you do that, though? How do you let go of the little stuff? Do you think about it differently?
Yes. First of all, we call it cognitive restructuring in the technical world. It sounds like I'm going to lobotomize people, but here's what I really mean is step back, make a list of all those things that really bug you and frustrate you, and then you've got to ask yourself, why do those things frustrate me? And is there anything I can do about it? And if not, then let go. Stop worrying about the guy in front of you who cut you off, because they're not cutting you off to do something to you. They don't know you, right? So again, it comes back to how you.
So let's talk a little bit about the physical downsides. What happens to you if you do have this kind of anxiety?
Well, all right, when you bring this on yourself, which a lot of people do, according to the American Journal for Preventive Medicine, those who have commutes longer than 10 miles one way will experience higher blood sugar, which can lead to diabetes, higher cholesterol, and also a higher incidence of anxiety and depression. So it's not only bad as a health thing for individuals, because we have 130-some million commuters in this country, but also for employers, right? You don't want your people being stressed getting to work, so I think employers also have to partner with individuals and their employees to figure out what are ways they can help them figure out.
But I think there's a debate there, because look, I think what workers would like to do is phone it in. I'm going to work from home today because I don't feel like coming in. But employers say, I need my team on hand because that's the only way we're going to get the work done. That's the most efficient thing to do for me.
So my argument to that would be sometimes we have to rethink what we mean by work and how we mean work. So do we have to do a 9-to-5 schedule? Some jobs maybe, some jobs maybe not. The reality is we're kind of caught in traditional work patterns and trying to apply them in a global digital age where time zones are coming into play because you're dealing with people all over the world. So if you can set up hours that help people get around rush hour, why not do it if you know they're going to come in healthier, happier, and more productive?
Nurses, doctors, people producing TV programs, much more difficult to do.
It is.
But it does work. And you mentioned to our producer, there's like people who are receptionists from home.
Yeah, so I had a client, no joke, it kind of freaked me out, but I walk in their office and literally this Segway-like robot with the little camera on it came out, and a picture of this woman is like, hi, how are you? And I'm like, okay. And she was 1,000 miles away remotely operating this robot to come out.
That's crazy.
So we can rethink these things, and we just have to spend time not getting caught in how it used to be done and think about how it can be done.
Some of the things the way it used to be done have to continue, and I think more ideas about changing mindset is great advice. Dr. Woody, thanks for coming on. Very good to see you.